Caroline, how are you?
Hi, I'm good. How are you doing?
Good. My name's Mackenzie. I'm a family nurse practitioner student that's going to be doing your exam today, okay? I'm just going to come over here and wash my hands. Great. Okay, so I'm just going to begin just by looking at you. I'm looking for any visible scarring, lesions. I'm going to feel the temperature on your arms and legs. So
Okay.
this part of my hands might be a little warm. Everything looks good. I'm just pinching for your hydration status. Everything feels good there. Looks like your hair is pretty nicely distributed. Any troubles with hair distribution?
No.
Very good. And I'm going to take a look at your nails if you don't mind. Perfect. And your feet as well. Great. Everything looks good there. So I'm going to move on to your head inspection. So first I'm just going to take a look at everything, make sure that it looks nice and symmetrical.
Okay.
And I'm looking for any obvious masses or anything like that, but it looks really good. So I'm going to go ahead and just start palpating your head if that's okay. Feels nice and symmetrical. I don't feel any lumps, which is really good. I want to feel your temporal arteries here as well. Great. I'm going to feel your sinuses. Wonderful. And I'm just going to take a listen to your temporal arteries.
Okay.
Grab my stethoscope here. Perfect. I don't hear anything, so that's great.
Okay.
All right. So I've inspected, I felt your head, I've listened to your arteries. I'm going to put my hands right by your ears.
Okay.
If you could go ahead and clench your teeth and jut your jaw out and go ahead and move it side to side. Perfect. If you could smile for me and frown and wrinkle your forehead and puff out your cheeks. Great. I'm going to take this piece of gauze and I'm going to have you close your eyes and I'm going to touch you in just a couple of spots, okay? A couple of spots on your forehead and your cheeks and everything, okay? So go ahead and close your eyes and tell me where I'm touching you.
Left cheek.
Great.
Right forehead.
Great.
Right jaw. Left jaw. Right cheek.
Perfect. Go ahead and open them up. You did great. So your head inspection is done. I'm going to move on to your eyes.
Okay.
So first I'm just going to take a look at your eyes. Everything looks good. I don't see any redness or anything. Any trouble with dry eyes? No. Good. So I'm actually going to just have you look down if you don't mind. Great. And look up. Great. Look down. Great. Perfect. So I'm going to turn off the lights really briefly and I'm just going to check for this reflex in your eyes. I'm going to turn the lights off over here. Alright, if you could just look straight ahead. Perfect. Alright, close this door again. Alright. So I saw the reflex I was looking for, so that's great. And I'm just going to continue to palpate just a little bit around your eyes, your tear ducts. Great. Perfect. Okay. So what I'm going to do now is I'm going to have you cover up your left eye. First, do you have any corrected vision?
Oh, I don't know.
Great. Go ahead and cover that left eye.
Okay.
And I want you to read this line here.
PECFD. EDFCZD. FELOPZD. DEFPOTEC.
Go ahead and switch your eyes. And can you start with this line backwards?
PCCFDE. FELOPZD. DEFPOTEC.
Great. Looks like you have pretty perfect vision. Don't have to worry about that. I'm going to go ahead and just take a look at your pupils here.
Okay.
You could just go ahead and look straight ahead. Perfect. All right. And I'm going to have you just follow my finger if you would, okay? Perfect. Looks like you have pretty good vision. Your eyes are moving nicely. And I'm just going to go ahead and do your full eye exam. So I'm going to go ahead and turn this light out over here. Open the door. Alright. I'm going to start with this right eye. If you could just look straight ahead. Alright, I can see everything really well. Move on to your left eye here. Looks great, Caroline.
Okay.
Okay. Turn this light back on there. Okay, so your eyes look great.
Okay.
So I'm gonna go ahead and move into your ear exam.
Okay.
So what I'm gonna do is first just look and make sure that everything looks symmetrical, which everything does, look great. I'm gonna feel that now. I'm gonna tug on them a little bit. Any pain or tenderness when I
No.
do that? Great. Do you have any trouble with hearing?
No.
Okay. Well, I'm gonna do a little bit of some hearing tests. if
Okay.
that's Okay. So first I'm gonna take my tuning fork here. And
Okay.
I'm gonna place it on the top of your head.
Okay.
And I want you to tell me if you can hear everything well in both ears or if it's easier to hear in one ear
Okay.
than the other. Okay.
I hear the same in both ears.
Great. So I'm gonna do another test on both sides.
Okay.
I'm gonna put it behind your ear and I want you to tell me when you stop hearing it.
Okay.
And then I move it in front and I again want you to tell me when you stop hearing it.
Okay. I don't hear it. I don't hear it.
Okay, good. I'm gonna do the same thing on this side.
I don't hear it. No, I don't hear it.
Great. Seems like your hearing is pretty good so far.
Yeah.
Alright. So now I'm gonna do the internal hearing exam.
Okay.
Just need to get my tool ready here, I'm sorry. Okay, so I'm gonna pull up a little bit on your ear. I'm just gonna take a look inside.
Okay.
Great. Same thing over here. Looks really good, nice and clear.
Okay.
Alright. So I'm gonna move on to your nose.
Kiddo.
I'm gonna switch my end here.
Okay.
So I'm just looking at the outside of your nose. Do you ever have any trouble with smells or bleeding or anything like that?
I haven't had any problems.
Do you mind if I just touch it? Okay.
Yeah.
Great. So I'm gonna just take a peek inside.
Yeah.
Looks really good. You been sick recently?
No, this means
Good. Sorry.
Okay.
All right. So what I'm gonna do now is I'm going to grab a smell.
Okay.
And I'm gonna have you close one side of your nose.
Okay.
And I'm gonna hold it in front of you. And
Okay.
then I'm gonna do the opposite on the other side. Okay. So go ahead and plug up one side of your nose. And I want you to tell me what you smell. Make your best guess.
Cumin? Says sage?
Yeah, it's cumin.
Cumin.
Perfect. So go ahead and do the other side. And tell me what you smell over here.
Ginger.
Perfect.
Okay.
All right. So everything looks good with your nose. So I'm gonna look at your mouth next.
Okay.
So I'm gonna put on some gloves here. Sorry.
That's alright.
Equipment.
Got a big.
All right. So first, I'm just gonna start by touching a few places around your mouth.
Okay.
Any pain or tenderness?
No.
Great. Can you just show me your teeth? Great. And go ahead and open up wide. Just gonna feel around your mouth here. Any trouble with missing or loose teeth? Okay. I'm gonna use my tongue depressor.
Okay.
I'm just gonna be looking with this light. Alright. Nice and and pink and moist. Can you say ah? Great. I'm just gonna feel your tongue. Great. Can you stick your tongue out at me and move it from side to side? Perfect. All right. Your mouth looks good. Great. And throw my gloves away. Okay, so we're gonna move on to your neck.
Okay.
Next. So I'm just looking for any visible masses or anything like that. It looks good. I'm gonna go ahead and feel your pulses here. Perfect. Looks great. I'm gonna feel your trachea. Great. And I'm gonna come behind you and I'm gonna feel your thyroid. If you could just swallow for me when I tell you to. Perfect. So one more time if you could swallow. Great. Looks good. I'm gonna take a listen to your neck.
Okay.
Listen to those carotid arteries. Perfect. Didn't hear anything, so that's great. And I'm just gonna feel for some of your lymph nodes to see if they feel enlarged at all or tender to you. Any pain or tenderness there? Perfect. Are you able to look to your left? Your
Or
left.
left.
And your right. Right. And look up. And look down. And tilt your head to the left. And tilt your head to the right. And can you shrug your shoulders? Perfect. Everything looks great with your neck. So we're going to go ahead and move into your lung exam.
Okay.
So first I'm just looking to make sure it looks like you're not struggling to breathe or using accessory muscles, but you look like you're breathing fine.
Yeah.
So I'm going to come behind you and place my hands on your back and I'm going to have you take a big, deep breath, okay? Go ahead and take a big breath. Great. Looks like you have good expansion there. I'm just going to feel your rib cage, if that's okay. Yeah. Back and front.
Trying to get a view of both of these.
Perfect. I'm sure I'm in the way of both of them too. I'm going to go in front of your rib cage here.
Okay.
Feeling for any like air trapped or anything like that, but it feels nice and symmetrical.
Okay.
I'm going to place my hands on you in a few places, and when I
Okay.
do, if you could just say 99.
99. 99.
You lift your arms up for me.
99.
And your back, perfect.
99. 99.
Great. So I'm gonna take a couple pounds on you in a few places, okay? I'm just
Sounds
looking
good.
for air or fluids. I'm just gonna lift up the side of your gown here. Great.
I'm sorry.
That's okay.
Try not
Great. You can let it down. I'm just gonna bring it back a little bit, okay? Very resonant. Sounds good.
to. Okay.
So I'm gonna try and find your diaphragm.
Okay.
So what I'm gonna have you do, perfect, is if you could take a big deep breath all the way in, and then breathe in even a little bit more.
Okay.
Go ahead. Perfect. Now go ahead and let it out. All the way. Perfect. Feels like a good distance there. Go ahead and relax. I'm going to have you do that for me one more time. Take a big deep breath in all the way. Great. Let it out. And go ahead and just keep breathing out. Feels good on both sides. Pretty symmetrical.
Okay.
That's perfect. So what I'm going to do now is I'm going to put my stethoscope to you and take a listen to you in a few
Okay.
places, okay? Big deep breaths every time, okay? I'm going to lift this side up here. And so the next thing I'm gonna do is I'm gonna put my stethoscope to you and I want you to whisper 1, 2, 3.
Okay. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3
Great. Now I'm going to switch that up a little bit. If you could go ahead and say E.
Yeah.
Okay.
E, 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 E.
Perfect. Sounds great.
Okay.
And one test I forgot to do a little bit ago for your ears. I'm going to come and like rub your ear.
Okay.
And I'm going to whisper some things.
Okay.
And I'm going to have you repeat it back to me.
Sounds
okay?
good. 6, 5, E.
Great. Same thing here.
PQ7.
Great. All right. So I'm done with your lung exam.
Okay.
I'm going to go ahead and move on to your cardiac exam.
Okay.
So if it's okay, I'm going to have you rest back.
Yeah.
Take this out for you. So first I'm going to have you just rest here, and I'm taking a look for any signs of distension in your neck. But I don't see anything. Perfect. So I'm going to feel around your heart for any heaves or thrills. Great. And if I could have you just turn towards me.
Yeah.
I'm going to just feel for your point of maximal impulse on this left side here. I can feel just a very light tapping.
Okay.
Which is great. And while you're on this side, I'm going to take a listen in just a few spots, okay?
Okay.
With both sides of my stethoscope. Great. And if I could have you roll back on your back.
Yeah.
And I'll look in the same spots with both sides of my stethoscope as well. Good. Sounds really good. I'm going to close this piece by your feet. Okay. Have you go to the side and just lean a little bit forward.
Yeah.
And then listen to the same places. Sounds really good.
Okay.
Yeah, always. So I'm done with your cardiac exam. I'm
Okay.
going to move on to your peripheral vascular exam. So
Okay.
I'm actually going to have you lay back
Sure
down
thing.
if you don't mind. Sorry.
Not at all.
Okay, so I'm going to start by just looking over your body one more time.
Okay.
I'm looking for any changes in your skin or anything like that. Everything looks nice. I'm going to check your capillary refill in your fingers. One of this hand. Great. Great. So I'm just going to be looking at a couple of the pulses and arteries and things in your body.
Okay.
Okay, so I'm going to start back up here with your carotids. Great. I'm going to feel down here by your wrist. And your elbow. Great. I can check over here, your wrist. And your elbow. Great, you can relax that arm. You could just bend both your knees just a little bit. I'm going to feel the pulses here behind your knees. Nice and strong. Very good. My hands are warm. Sorry.
Feet are freezing, sorry.
You're cold. Pulses in your feet feel great too. So I'm just gonna check some lymph nodes here in your elbow as well. And on this side. Great. And behind your knee.
Mm-hmm.
Don't feel anything there. And I'm gonna take a listen in a couple places
Okay.
as well, okay? Let's start here, your aortic area. Great. Your renal. Iliac. And femoral. It's gonna go a little bit under
Oh,
the
yeah.
last waistband,
Okay.
okay? Great. I'm gonna feel them as well, if that's okay.
Mm-hmm.
Perfect. Everything feels really great.
Okay.
So that pretty much finishes your peripheral vascular exam. So I'm gonna have you keep laying down. I'm gonna move on to your belly.
Yeah.
Okay. So I'm just gonna. That's okay. I was gonna take a look at your belly, make sure everything looks nice and symmetrical.
Okay.
It does, and flat. And I'm gonna take a listen in a couple of places to your belly. Did you eat recently?
I've been eating and I'm also hungry, so
It sounds like
there are
it.
a lot of sounds in there.
Sounds good. So I'm gonna percuss your belly like I did
Okay.
your lungs, just
Okay.
a little bit around the whole area in general. And down here a little bit by your bladder. Great. Checking for your gastric bubble. Good. Everything sounds nice and tympanic,
Okay.
which is exactly what we hope to hear.
Okay.
And now I'm just gonna do a little bit of touching.
Okay.
I'm gonna start with a really light touch here.
That's good.
A little bit deeper. Any tenderness there?
No.
Okay, good. I'm gonna go ahead and palpate for your liver.
Okay.
I'm sorry, I'm gonna percuss for your liver.
Okay.
So I'm gonna start up here. Great. Come up from here. Great. Feel like a good area right there. And check the same thing for your stomach.
Okay.
Great. Feels like it's right in here.
Okay.
I'm gonna try can feel them. So what I'm gonna do is I'm gonna put my hand under
Okay.
your back, and I'm just gonna have you take a big deep breath, if you could, and let it out. Great. I'm gonna come over to the other side and do the same thing. I'm gonna slide my hand under here, and go ahead and take a big deep breath, and let it out. Great. All right. And I've checked your bladder. I'm gonna go back and take a listen
Okay.
over your liver and stuff.
Oh, okay.
Go ahead and take a big deep breath. And one more. Sounds good.
Okay.
Okay, so I'm done with your abdominal exam. I'm gonna have you sit back up.
Okay.
I'm actually gonna place my hand on your back and I'm gonna
Okay.
sort of hit you a little bit. So I want
Sounds
you to tell me if it hurts,
Oh,
okay?
that sounds
Nope. Doesn't hurt. No pain there.
Mm-mm.
Good. So I'm gonna move on to musculoskeletal
Okay.
exam. So if I could have you carefully stand up on the bottom here.
Yeah.
Just take a step down. And I'd like you to take a walk from about where I'm standing here, that direction, just a couple steps. Great. And come on back. Right, your gait looks nice and steady. Do you have any trouble with balance
Not
or
at
anything
all.
like that? Perfect. So I'm gonna check your spine.
Okay.
If I could have you just stand right there for just a second.
Oh, yeah.
Great. And if you could go ahead and like lean, like bend forward towards your feet. Great. Everything feels nice and stable. I don't feel like your spine is crooked or anything. So I'll have you go ahead and have a seat back up there for me. And we're gonna test the muscle movement and strength in a couple of
Okay.
places. So what I'll have you do is if you could take your arms and put them out to your side. Great. And if you could go out in front and up and put one arm back behind and the other arm. And if you could go behind and behind again. And if you could cross over your body.
Mhm.
Cross over your body. If you could put your arms behind you. Perfect. So if you could bring your hands up towards your chest and back down and turn them in and turn them out. Great. And if you could hold your wrists out and bring your wrists up towards you and back down and in and out. Spread your fingers, pull them in, make a fist. Great. So I'm going to test some strength in your arms.
Okay.
So if you could try and push your arms out to the side against my strength. Great. If you could put your arms out and try and bring them down.
Mm-hmm.
Great. If you could try and bring your arms up to your chest and back down. Great. Can you try and bring your wrists up towards me and back down? Great. Can you squeeze my fingers? Great. Try and push your fingers out. Great. Now put your fingers out and try and push them in. Great. Okay. We're going to move on to your hips. So I'm actually going to have you lay back one more time.
Okay.
Stretch those legs out. If you could bring your left leg out over the side of the exam table. Great. And then back in and cross it over. Perfect. And do the same thing with that right leg. Perfect. And if you could bring your knee to your chest. And your knee to your chest. Great. Any pain when you did
Not
that?
at all.
Great. If you could try and push your legs out and try and push them in. Great. And then you sit back up.
Okay.
And if you could kick your legs out in front of you and pull them back in. Now do it with me here to embrace them. Push out and pull back. Great. Can you kick your ankles up and down? And can you move them in and out? Great. Now can you push your feet up against my hand and pull down? And try and push them in and out.
Okay.
Everything feels nice and strong. So I'm going to go ahead and move on to your neuro exam. So I'm going
Okay.
to ask you just a couple of weird questions. The first one is, can you tell me your name?
Caroline Victor.
Great. And what's today's date?
Today is April 8th, 2016.
And when's the next birthday in your family?
It's May 20th.
Oh, Aquarius. Coming up.
It is, yeah.
Can you count backwards from 7?
7, 6, 5, 4, 3, 2, 1.
Isn't too easy. What does it mean when someone says silence is golden?
It means that silence is a treasure. Having quiet is a treasure.
It sure is. So what I'm gonna have you do is a couple of weird tests.
Okay.
So the first one I'm gonna have you do is take your fingers and touch each one to your thumb, and then try and do it a little bit faster. Great. If you do the same type of thing with your hands on your legs to touch your knee, and flip your hand. Great. If you could touch your nose and then touch my finger. I'm gonna move. Okay, I'm gonna stand in one place. Keep going. And now I want you to close your eyes. Perfect. Go ahead and stop. What I'd like you to do now is to close your eyes and hold your arms out in front of you. Gonna wait about 60 seconds, make sure there's no tremors or anything. Looks great, perfect. You can relax.
Okay.
So one thing I'm gonna do now, I'm gonna have you close your eyes again. I'm gonna hand you an object, and I want you to tell me what it is. So go ahead and hold your arms out.
It's a cube.
It sure is. All right.
Can I open?
You can open your eyes.
Okay.
So what I'm gonna have you do now is stand back up for me.
Okay.
You could walk the same path you did before, but do
Sure
it
thing.
heel to toe this time. And come on back. Great. And you can stand right there. If you could go ahead and close your eyes and just stand in one place. You can actually hold your arms out. Perfect. And we've got about 60 seconds. I don't see you swaying too much. You can go ahead and relax.
Okay.
Perfect. And have that seat back down there. I promise I won't make you stand up again. So I'm going to test a few more things.
Okay.
I'm going to have this tuning fork vibrate. I'm going to place it on a couple of spots.
Okay.
And I want you to tell me where I'm placing it.
Okay.
So close your eyes.
Left elbow. Right knee. Left knee. Forehead.
Great. And I want you to keep your eyes closed. And I have a dull and a sharp object. This is the sharp object.
Sharp on my left.
And this is the dull.
Oh.
Okay. I'm just showing the difference. I'm going to touch you in a couple places and I want you to tell me where it is, okay? And what, if it's sharp or dull.
Sharp right thigh. Dull left thigh. Dull right arm. Sharp left arm. Sharp left leg. Sharp right leg.
Great. You did wonderful.
Okay.
All right. And so I'm just going to do a couple more things for reflexes.
Okay.
Okay. So I've got my reflex hammer here. I'm going to check a couple places on your arms.
Okay.
So I'm going to take this arm and just try and relax it as much as possible. Great. I'm going to flip your arm in. You could bend your elbow up. Perfect. And relax. Great. And here on the inside of your arm. Great. Do the same things over here. Relax this arm totally. Great. Can you bend that arm in towards you and relax it? Great. Here on the inside. Alright, can you relax your legs as much as possible? I'm gonna come over here so you
Okay.
can see me. And relax. Great. Take your shoe off. And I'm gonna look at your ankle here.
Definitely fall.
And the bottom of your foot. Great. And I'm going to take the shoe off and look at your ankle here. What?
I'm ticklish. So.
Oh. All right. Got nice reflexes there. So I think we're all done with your exam.
Okay.
Everything looks good.
Thank you.
All right. You're very welcome.